Thank you, Speaker. Last week, Dina, a resident of Extendicare's West End Villa, was forced into a move she didn't want to make, thanks to the government's Bill 7. Dina had temporarily ended up on a floor run by the Ottawa Hospital after they took over management of 2 floors at West End Villa. Warned that she was facing the possibility of being moved far from family and hospital charges of up to $1,800 a day, Dina was forced to accept a room in this for-profit facility that she does not want to live in. Why is the Premier insisting that no one will be coerced against their will when it's already happening to patients like Dina?
The Minister of Long-Term Care.
Well, Mr. Speaker, look, we just passed the bill yesterday. Having said that, Mr. Speaker, we do contemplate working with hospitals to make space that is available in long-term care homes available to our hospitals, so that patients who need more complex care can have that care. That is something that has been working very well in communities across the province of Ontario. It works well in Markham Stouffville. It has been working quite well in Ottawa, Mr. Speaker. That is part of our changes to the healthcare system, part of modernizing the healthcare system. We've said it a million times. We are not just going to simply go with the status quo. It is not a good level of care. When a person who wants to be in long-term care is sitting in a hospital, Mr. Speaker. This has been the case in this province for years. I read you yesterday a report from the Auditor General dating back to 2011 that highlighted how dangerous it was to have seniors waiting in a hospital when they should be in a long-term care home. We're acting on it, Mr. Speaker, and that is one of the ways that we're doing it.
Supplementary question.
Speaker, Dina may be bedbound, but she has the same right to choose where to live that we all have.
That's right.
People don't become disposable just because they're elderly or they have a disability. But instead of being able to choose a new room or a new facility herself, she was told, take this one now, or next week we can put you wherever we want or charge you whatever we want. And it's this government's bill that was used to coerce her decision. Will the Premier finally acknowledge the danger and stop Bill 7 from coming into force?
Minister of Health.
Thank you, Speaker. You know, I think the member opposite is losing track of the fact that we have patients who are sitting in hospital beds who need to be better served in community. That can, in some cases, be in a long-term care home. And I want to reinforce, Bill 7 ensures that the individual, even if they are moved into a long-term care facility, will still have their priority list of 5 there, so that when a bed is available in the long-term care facility of their choice, they will have that opportunity. But I have to remind people that hospitals are not homes. We need to ensure that people have the ability to live out their lives in community, in long-term care homes, where there is social programming, where there are opportunities for enhancement, which is